Alright, so Electrophysiology of Estim Part 2, we're going to talk a little bit more about individual parameters that can be set on the machines. So by the end of this lecture and your practice time, I want you to be able to state the effects of all the different things that you're able to vary and change on the machines. The waveform, the amplitude, the duration, frequency, everything that you can spin a knob or push a button and change. Alright, so let's first talk about amplitude and pulse duration. So the amplitude is what you're setting when you turn the big volume knob on the front of each of the machines. And that's increasing the current amplitude, or it's increasing the intensity of the stimulation. And whenever you're seeing a diagram, that's going to be the y-axis. The current amplitude is going to be the y-axis. So in this diagram, it would have the effect of making those rectangles taller if we are increasing the current amplitude. Okay, so and at a fixed pulse duration, so you can see there what the pulse duration is defined as. That if we're setting the x-axis duration of those waveforms that you see, and if we're increasing the height of those, you can see that that would increase the area underneath the curve. If we increase the area, we've increased the pulse charge, and that helps to determine what type of response is evoked. The response being, am I getting to sensory level stimulation, motor level stimulation, or am I starting to cause some pain? Alright, so the pulse charge is defined as the area under the curve for a particular waveform, and the charge is very important, as that is what is thought to give us the effects of electrical stimulation. So if we talk a little bit more about the pulse duration, so we can also vary that usually within the edit screen. So usually it's a little more difficult to change the pulse duration, but that's easily done on most machines now. And so you can see if I'm able to change the width of those, and as a matter of fact on some machines it will be called the pulse width. It's actually a bad terminology, but you'll see it called that. So, but if we think about in terms of what kind of spread across the x-axis we have there, you can see that will also change the shape of that waveform, and it will increase the surface area. So I can, or the charge, the pulse duration, which is going to give me more of the pulse charge. There we go, or the area. All right. So if I increase the height of the shape, I increase the area. If I increase the width of the shape, I increase the area. And so the nice thing on the machines is I can do both. All right, so I can change my pulse duration, and then that will change then what I have to turn the amplitude to get an effect. All right, so the duration then, again, increasing the duration gives us an increased charge. And back to our pulse duration curves, and again, this is the very, very important diagram, because if you understand this, you pretty much will understand Estim. In that it's showing us the current amplitude on the y-axis, and it's showing us various durations across the bottom. And you can see it's showing from 20 to 100. That's our preferred pulse duration for a sensory response. Our 100 to 600 millisecond duration is our preferred duration for a motor level, and over 600 is our noxious level area of stim. And looking at the curves, you can kind of see why that is. If I'm in the 20 to 100, I'm going to get to the sensory level stim fairly quickly. If I'm in the 100 to 600, I'm going to get to the motor level stim quickly. And if I'm greater than 600, as I turn up, I'm going to get to noxious level stim fairly quickly as well. Okay, so as far as setting an amplitude, and we talked about this in class, but we can't say what a specific setting is going to be, because that's going to change depending on how sticky your electrodes are, where you put the electrodes, how sweaty someone is. There's so many parameters involved in actually what the amplitude is. There's no set amplitude. So the key point here, and this is very, very important, you want to set the amplitude to get the effect that you want. Right, so if you're working in a clinic and they're setting up Mrs. Jones and setting her to, a 50 on the screen every time they set her up, they're going to get a different effect every time, because whenever you change the pads and change the location slightly, or as the pads get older, lose their stickiness or lose their ability to conduct, okay, you're going to get a different effect. So it's very, very important that you set the amplitude based on the effect you want. If you want a good quad contraction, you turn it up till you get the quad contraction you want. Okay, if you just want intense tingling, you turn it up till you get the intense tingling. So you don't really even need to look at the numbers. And again, the amplitude is set via that intensity control knob on the front panel. Okay, so something else that we can vary is the frequency. Frequency is typically measured in cycles per second or pulses per second and has the abbreviation of Hz for hertz. Okay, and when we change the frequency, we're affecting the pattern or quality of the response. It doesn't have anything to do with if we're going to have sensory or motor or pain response. It's just going to do various things. For motor level stim, in order to get a good contraction, we need to get our frequency up over 30 hertz. And you'll see that most of our machines come to life for the default parameters at about 50 hertz. In order to get a nice tetanic or smooth full contraction, we want to get it over 30. If you get much less than that, you'll usually get a subtetanic or not smooth contraction. All right, so you can practice that in the lab. So increased frequency will increase the force a very, very small amount. So we're not going to try and increase the force of our contraction or to get a better contraction by using frequency. Or more forceful contraction, I should say. We're going to use it to increase the quality of our contraction. All right, so the other thing that increasing frequency does, though, since we're firing off those action potentials at a much higher rate, we're going to increase the fatigue. So at a given force output, the muscle is going to fatigue a lot faster. So that might be a reason for turning it down, going from maybe 80 down to 50. Or if I want to increase fatigue, maybe I do want to fatigue the muscle rather quickly, I can crank that up and I'll fatigue the muscle a lot faster. All right, for sensory level stim, and we'll talk about different currents here in another lecture, but what you'll usually find is what's called high frequency TENS is usually set to about 100 or 120 hertz or cycles per second. All right, so motor level stim is going to be down in that 30 to 50 range. Sensory level stim usually going to be higher, and there are many cases where it's lower, and we'll talk about those as we get into talking about pain relief. Okay, so different modulations are available on different machines, and usually modulations are there to limit the adaptation of your patient to a particular stim. On a TENS unit, you'll see that listed as maybe a burst mode. Some machines you'll see a thing that says, amplitude modulation or frequency modulation. And so what that's doing is it's changing, if we said it was amplitude modulation, it's going to vary the amplitude by a set percentage. And a lot of times that's what your setting is. You'll set in like 10% or 20%. And so when you set up an initial amplitude, what the machine will do then, once you hit the start button, it will automatically vary that amplitude down 20%, up 20%, down 20%. Okay, it won't go beyond the maximum intensity that you set. It'll take that kind of as the baseline and drop it from there. Okay, so you might also have the ability to modulate the frequency, and it'll take the frequency and move it up and down. This is very commonly done on interferential machines and in pain relief modes for both TENS and interferential machines. So, and again, that's to decrease the adaptation, the adaptation being, we're getting used to that particular stimuli. And so if you want to decrease that, you use some of the modulations that can be done. Okay, so ramping, and with ramping, we're really only talking about motor level stim here that we're going to be using a ramp for, and that's simply and purely for patient comfort. All right, so you can usually set that ramp anywhere from 2 to 5 seconds, and so as the current starts to ramp on to cause a muscle contraction, okay, it'll go at a nice slow rate, so it's more comfortable for the patient. That's all it's for, it's patient comfort. On-off times. Okay, you're only going to see on-off times on our motor level stims. The 2 motor level stims that we're going to be using are going to be biphasic and Russian stimulation. Again, you can also do it with high volt, but mainly we're going to be using biphasic and Russian. But our on time is usually measured in seconds, or off time can be either measured in seconds or minutes. And since we get an increase of fatigue, the quicker that we're contracting a muscle, with a shorter on to off ratio, then we're going to increase fatigue. So as shown in the last bullet there, is that if we're going to want to work on endurance, we're going to set that closer to a 1-to-1 ratio, say 10 seconds on, 10 seconds off. And if we're going to want to do strengthening, just like if we were going to the gym and you're going to do a set, say a set of bench press, and then you take a minute or two in between and then do another set, that's really what you're looking at here, is that you're going to do, so for strengthening, if I was doing that at 10 seconds, then I'd rest for 50 seconds before the next stimulation would come along. So looking for those two different effects, we'll see those different things in the charts. All right, so we can also have different types of timing modulations. And now here we're talking more along the lines of our Russian. The bottom two diagrams here are demonstrating Russian current. Looking at the very bottom one, it's just unmodulated. Okay, nothing's been done. If that thing's running at a carrier frequency of 2,500 hertz, we get 2,500 of those a second. All right, so if we go into to start to modulate those with time, and you can see in the middle diagram then there's an interburst interval, and so the burst has run for 10 milliseconds and then it's shut off for 10 milliseconds back on. Okay, so that would be an example of a burst modulated alternating current. Okay, so a lot of different variations here, but as you can see, you know, what parameter, if I ask the question, what parameter would increase the pulse charge? Okay, the answer there would be I'm going to either decrease my inner burst interval, okay, or increase my burst duration. And some of that's going to depend on what the manufacturer is giving you as something to vary. So that's going to be analogous to our phase duration that we already saw. So another type of modulation that you might encounter, and that's what's called a beat modulation. And this is what we call interferential current. And what we're doing is we're setting up what's called a beat frequency, and we do that by taking two different waveforms. And what you see on the right hand side of the screen is you see a waveform that's running at 4,000 hertz, and underneath it you see one that says 4,100 hertz, and those are all cycles per second. As you can see, those are AC type currents, alternating currents, are going from positive to negative. And if you lay those two on top of one another, you see there are points where a peak lines up to a peak, and that adds up and makes a larger peak. And you see where a peak lines up with a valley, and it goes to zero. And so the third one, the third part of the diagram, is showing you a third current that's created by adding the first one to the second one. And that's what's called interferential, interference type current. And that third current is called a beat frequency. And that's just equal to the difference in the two carrier frequencies. In some texts, you might see this called MF beat AC, but really everyone calls this interferential current. Primary use for this type of current is pain relief. But here we're just mainly talking about it as a type of modulation. The other type of current, we'll talk about this in another lecture, but different types of currents. But pre-mod, you'll see that on our machines as well. And what that is an interferential current that's been mixed inside the machine. Okay, so when we're setting this type, this interferential current up, we're setting 4 pads. I think everyone kind of knows that. We use 4 pads. We use 2. We're crisscrossing those. We're putting 2 different currents in. We're getting a third. And pre-mod, same thing. It's only using 2 pads, and the currents are mixed in the machine. All right, so that's just another example of a modulation. Okay, so the claim for IFC then, because of those high frequencies, it's supposedly more comfortable. And you have some other type of modulations that are there on just about every time you run into an IFC current on a machine. And they may be labeled different things, but one common label is a sweep, and that's called a sweep, and that's used to modulate the beat frequency, used to counter accommodation, and then a scan, which modifies or modulates the current amplitude. In other words, it makes the current amplitude go up and down a little bit. And then the patient feels like the stimulus is changing locations a little bit. So you have the big setup with 4 different pads, and it'll feel like to them that it's scanning or moving. Okay, and typically that's used for a larger area, but that's all we're doing with those things. All right, and then duty cycle. So really, the only area that we're going to deal with a duty cycle is with Russian stimulation. And duty cycle is defined as the time a current is being delivered divided by the entire cycle time. So if we look at this diagram over here where it says width or duration, and then we have a rate, you can see that we have a period of time where the current is on, and then we have a time that where the current is off. And so if we said that that was on for 10 milliseconds and then off for 10 milliseconds, the total time is 20 milliseconds. And since we take the on divided by the total time, we get 10 over 20, and that is a 50% duty cycle. All right, so again, for the currents that we're using, this is really only going to apply for our Russian stimulation. And on the Solaris machines, you don't even find that that thing that says duty cycle. You're able to change the pulses per second. This is a little confusing. So one of the things to do is to go look in the Solaris manual at pages 49 to 50, and it gives a pretty nice explanation of how these two are interrelated. But just keep in mind that the definition of Russian current is a 2500 hertz carrier wave at 50 pulses per second. Okay, so at a frequency of 50 pulses per second. And so that's usually what your Russian machines are going to come alive at, or the default parameters are going to be. Okay, so let's talk about electrodes a little bit. We have a lot of different electrodes, and we have a lot of different factors that are going to affect whether or not your electrodes are going to work okay or not. And this fella here in his mohair pajamas is definitely going to give you problems. And so you're going to need to bring out the bush hog if you're going to have anything, have any luck getting anything to stick here. Okay, so we've seen the two different types a little bit in labs, self-adhesive versus carbon electrodes. And one of the important things to keep in mind, and especially as you're doing these different treatments on each other, is that comfort is directly related to the size of the contact area, and you got to have good contact. Okay, if someone's complaining of pain, or it's not, it's not comfortable, either the pad is not sticking very well, or you just need to go to a little bit bigger pad, and they'll be able to tolerate more stim intensity with less painful response. Okay, with you get someone like this, you're going to have to either clean, or hair is going to be clipped. Okay, so always make sure too that you're discarding old electrodes. In the Solaris manual, they recommend that electrodes are never used more than 15 times. That's probably a pretty good rule of thumb. Hopefully you get that many uses out of them. And one of the things that I recommend too is that after every use that you just put a few drops of water on the reusable electrode and then stick it back onto its pad, and within a couple hours it rehydrates quite a bit, and you'll be able to extend the life of your electrodes that way. Also, just inspect them critically. You'll see kind of a stimulation pattern where the charge is coming through after you've been using one a few times, and if that's really small, you should probably change manufacturers of your electrodes. But the other thing too is just discard them and try another pair. All right, so the big thing to keep in mind, and this is when we talk about electrode coupling, is that we're increasing our charge density, or how much charge is coming through that pad with increased pressure. And also, if we have a decreased contact, we have an increased charge density because we've decreased the contact area. All right, so it's basically, again, it's pushing that electricity through a smaller hole. All right, so if you just kind of keep that analogy in mind, that'll probably help. But pads are very important and very much neglected. So if you're working in a clinic, the only thing they have is 2x2s. Insist on getting some big electrodes ordered. Get some 2x4s or some big circular ones, or dig up the carbon electrodes that they have sitting around somewhere in a drawer that's not being used. All right, so the key point, and that's that if you increase the size, you're going to increase the comfort at higher levels of stim. And if you get nothing else from this part of the course, just think about how important your electrodes are, and especially at getting a comfortable treatment. Okay, if you're having problems, one of the first things you can do is change out the pads, and also make sure that you've got big enough pads in place. All right, so reasons for using smaller electrodes, though: you can focus treatment on a smaller target tissue. If you're trying to stimulate something in the wrist or the hand, you definitely want to use something smaller. Okay, so but as you turn it up, just know that you're liable to get a little bit more discomfort. Now sometimes you'll see us set up with unequal electrodes. Pretty much with our modern day currents, you're not going to see this a whole lot. The main one that we're going to use that we'll see two different electrode sides, and that's going to be using high volt. And so when you use unequal size electrodes, by definition, the larger one is called a dispersive. And the reason that we're using the two different size electrodes is we are trying to focus that effect at one of the two electrodes. And so usually that's you can set that up on the machine to whether that small electrode is either the positive or the negative pole, or by definition the anode or the cathode. Cathode being negative, anode being positive. Okay, number of electrodes. A lot of different arrangements you can make with your wiring. If you have the right types of wires. Remember, you always have to have two. Okay, so two are required to complete the circuit, and then adding more are going to decrease the charge density when they're on the same current. And you can kind of see that in these examples. So in example A, you've added 4 pads on one channel, so there's 2 for each side, and so that's going to make for a fairly comfortable level of stimulation since it's coming through all that surface area. Okay, and so you'll also hear the terms monopolar and bipolar. And monopolar setup is what we talked about just a second ago, one where we've got an electrode that's much smaller than the other. And then bipolar, and that's typically what we're using on just about everything else. And that's where both the electrodes are the similar size. And so mainly for terminology, just so if you see those terms, you'll know what someone's talking about. So how far to put these things apart? So just keep in mind that the closer they are, the more superficial the current flows, as we see in the diagram right here. And the current may actually arc between them if too close. In other words, if they're touching, the current's going to take the path of least resistance. And if they're close and or touching, it's just going to jump from pad to pad, and you're not going to get a whole lot of effect down into the tissues. So a good recommendation is don't place the electrodes any closer than half the diameter of each electrode. And then orientation, we're going to get a greater effect when the electrodes are parallel to the directions in which the muscle fibers are running. So and also take into account the location and depth of where the nerves, trunks and branches are, and also for the motor points of the muscles. So remember that when we're using pads like this for stimulating muscle, okay, really what we are stimulating are the nerves and the motor points. So if you can get these pads, closer to a large major trunk of the nerve or to the motor point, you're going to be better off. And then try and align the pads somewhat along the fibers. Okay, don't try and place them side by side, horizontally. Place them vertically, like we're seeing, here over the gastroc for this picture right here. And then polarity. We really don't have to worry too much about polarity. It's only going to be a factor with our monophasic currents. The only two currents that we'll use would be DC, and mainly that's going to be used for iontophoresis. You'll need to know which polarity is and what the drug polarity is in order to push the drug through the skin. And then the other one is going to be for high volt galvanic. High volt is a great current. It's pretty versatile because you can use it for stimulating muscle, you can use it for pain relief. You can use it for wound healing because it has the polarity effects, and so it does make a difference on which pad you're using. And the typical rule of thumb is that you're going to use the cathode or the negative electrode over the target tissue. But you'll see, like for a lot of times for let's say for an acute ankle sprain, great protocol for that, and it'll start with the negative over the swelling area, and then after a few minutes you switch it and switch it to the positive. So like I said, it can vary, so you just got to look at what protocol you're trying to follow. All right, so we spent the past several minutes looking at a little more detail about the effects of all these different things that you need to know about. Right, so one of the best ways to understand these, sit down at the machine and start to play with them. Okay, play with the different waveform, play with the amplitude. We've already done a little bit with waveform. Haven't looked so much at the amplitude, but you need to play around with the duration. And recall that duration, we're really only talking here in our biphasic current. And for the Russian, you're either going to be playing with the duty cycle or the pulses per second. Kind of depends on your machine. So the frequency, remember that's going to affect your quality of the contraction. Ramp time is going to be for comfort, and then you play around with your electrode placement. So lots of information, lots of different things to become familiar with. And one of the confusing things is it's different on different machines. So you need to be looking at both machines. You need to pull the manuals out and push the buttons and see what happens. All right, have any questions? Drop me a line.